The US is quickly getting to that point because, again, the US is not following, they're not listening, and they're not following the guidelines of the people who know what they're talking about to show them what to do. So this thing, it has 3 lessons, and let me highlight what those 3 lessons are. And I'm saying it because we need to ensure that we don't make the same mistakes in Tobago. And I'm saying it now because we're already making the mistakes. But we still have time. We still have a little bit of time. We still have this window where if we shift, we can still prevent this from becoming a catastrophe. It says, protect your staff. Protect your staff. That's one of them. And protecting your staff talks about things like ensuring you have proper PPEs in the volume that it needs to be in, and in the kind that you need. Now, one of the things that this highlights, and it was critical, 2 things. One, it suggests that we do not treat COVID-19 patients in the hospital where we are treating non-COVID-19 patients. One of the first things they said very, very early up is that if they had known, they would have separated the physical location where COVID-19 patients are treated versus where non-COVID-19 patients are treated. Why is this? Because the virus is so tricky. The virus moves so quickly that you can quickly go from being in the space with COVID-19 patients to being in the space with non-COVID-19 patients. As a matter of fact, I'm not sure if it's this article or another one. I read these articles continually, so it's all becoming one article in my mind. So I can't confirm whether it's this exact one. But there was a report that showed that in areas where they had one hospital, COVID-19 patients and non-COVID-19 patients in the same facility, the areas where they were treating the COVID-19 patients, because they were so careful as it relates to PPE, sanitizing, ensuring that rooms were negative pressure and all of that stuff, they were so good in those areas that they had limited cross-infection, meaning people who the staff didn't get sick, people who were not already sick did not get sick. But in the areas, in the same hospital, in the areas where they did not have COVID patients, the rates of COVID-19 infections in those areas were really high because they had relaxed PPE guidelines. See, the PPE that you use for COVID-19 includes I'm sure you've seen it, the masks, the gloves, the shields, the coats, the this, the that, the other. I mean, by the time you are done putting on the PPE, you've added 2 or 3 or 4 layers. But because they were in the side of the hospital without COVID-19 patients, they did not PPE down the way they would on the side with COVID-19 patients. And they recognized that they continually got infections of COVID-19 in the non-COVID-19 area. And that is because you have to divide resources as it relates to treatment of COVID-19. Resources meaning everything. Resources meaning everything. So you have a facility for the COVID-19 patients, you have a separate facility for the non-COVID-19 patients. I understand in Tobago, the Minister for Health, or maybe the CMO this morning in the press briefing, did admit that we still have a COVID-19 patient in Tobago in the hospital, the same hospital with the other patients. If you have been in the hospital, you know that we have had wards without AC. We have had all of these issues, which means we cannot control the flow of air in the hospital. As much as it was wonderfully built a couple years ago, we cannot control the flow of air in the hospital. And let me just say quickly, let me just stick a pin in it as it relates to the isolation and negative pressure. Isolation rooms, which are rooms that you, as it says, isolate. Remember, we isolate sick patients because we want to keep them separate from the patients who don't have that disease. Isolation rooms are supposed to have negative pressure. What does that mean? Negative pressure means it's like water, or it's like anything else. What's the word? Diffusion, that's the term. You go from an area of high to an area of low. That is the entire principle of diffusion. The same applies to air pressure. You go from an area of high to an area of low. So isolation rooms are supposed to have negative pressure to allow air from outside in, but it should not allow air to go from inside out. And that makes perfect sense. If in that room you have patients with COVID-19, patients who may be coughing and sneezing and all of that, patients who you may have done aerosol generating procedures, meaning you're intubating them, you're nebulizing them, you're doing those things which are what is necessary for saving their lives. Those procedures can cause the SARS-CoV-2 to be aerosolized, meaning it is now floating around in the air. So it means you do not want air from those rooms to go into the other rooms. That is why isolation rooms are supposed to have negative pressure. Negative pressure meaning there is lower pressure in the room compared to outside of the room. It means you are allowed to get air from outside in, but you cannot have air from inside out. Do we have real isolation rooms in Tobago at the hospital that we seem to not even be able to have air conditioning in some wards? Do we really have that kind of control? And if the answer is we're not sure, then that automatically tells you that we should not be having COVID-19 patients in a same space with other patients. Because remember, we've always been saying that the people who are most at risk for having severe COVID-19 symptoms and dying are people with comorbidities, meaning they have other illnesses. Who are the people in hospital? People with other illnesses. So we should not have COVID-19 patients around people with other illnesses. It is a recipe for disaster. We have other facilities. The rest of the world, you are seeing them using football fields, putting up makeshift hospitals, putting up beds with ventilators in the makeshift hospitals, and that's where they are treating their COVID-19 patients. We have 20-something health facilities in Tobago. All of these health centers, every village or every other village has a health center that is not used most of the time. We could have picked one of those to use as our COVID-19 center. Granny, before she left, spent a whole lot of money updating up by the old fort. Now granted, I don't think that is an ideal location because it was never decommissioned properly when we moved from the old hospital up the fort to the new hospital. But we just spent a whole lot of money painting and tiling walls and all kind of story. We could have used a space like that to house the COVID-19 patients to ensure we do not contaminate our hospital where we have people with comorbidities. But no, we've already contaminated the hospital. And we have other patients in the hospital that is already contaminated. So, I am pleading and begging for those who have the authority, because I am just a minority councillor who does not have the authority to march up into the TRHA and tell them what to do, or I would have. We hope that they are listening and that they can right this wrong now before it is too late. Going back to the article, protect your healthcare staff. And protecting them means giving them PPEs, ensuring that they are tested for COVID-19 regularly, ensuring that they are thermal tested. Because those who are in the health sector, thermal testing measures fever. Okay, that is what thermal, your temperature. And it's one of the easiest ways to see whether somebody, because fever is one of the most common symptoms of COVID-19. So we should be testing our healthcare professionals every day, multiple times, even within the shift, to ensure that their temperature is not rising. Because that's a first clear indicator that, hey, we need to do something. We need to probably pull this person out of service. Because remember, if you have a healthcare professional who has COVID-19, even though they don't have other signs and symptoms, they are going around. A nurse, for example, may have 5-10 patients that they're testing blood pressure, testing sugar, all of this stuff, giving medication, all of this. And they may not have COVID-19, they may not know they have COVID-19, but because they're interacting with all of those people, they can pass it on to those patients. They can pass it on to those patients, which we can't have. Let me also make one thing very, very clear, because I heard it said before, and I think it's one of the reasons the Minister of Health and the Prime Minister had to buffet. Last week, or whenever it was, there was a comment made by some of our officials in Tobago that spoke to the fact that we have had at least one case of a medical professional having COVID-19. And because that medical professional and the other medical professionals who that person came into contact with, they were self-monitoring, but they were still at work. Now, when I saw that, honestly, my head almost exploded, because I couldn't figure out. I mean, we are telling everybody, every random citizen, if you have cold and flu-like symptoms, stay home, don't go to work. But you're telling me that these health professionals who may have been exposed, you're still allowing them to work because. Now, I did some research and I recognize that that is actually a protocol that is used in health facilities that's treating people with COVID-19, or a health facility that deals with infectious diseases. And let me explain what that means. So if you are at Kuva or Cora, where all of the patients there have COVID-19, TB, or some other infectious disease, right? Even if you are a health professional who may have been exposed because of whatever, breach of your PPEs, whatever, but you may have been exposed, but you are not showing any signs and symptoms just yet, you may be told to stay at work and keep working because you are healthy, because you do not run the risk of infecting any of the patients, because all of the patients already have COVID-19 or TB or whatever it is. So even if you become sick, the risk of you infecting a patient is nil, because all of the patients already have that infection. So you see the difference. So and for people like that, they thermal test them every couple hours, just so as soon as they see that body temp going up a little bit, as soon as they see that, they pull them out. That is the difference. We cannot do that in a regular health facility where you have other patients who don't have COVID-19. Again, it is a recipe for disaster. It is crazy to even think that that is a protocol that you can follow in a regular hospital. And that is why it is so important to have division of resources. And that's actually one of the other recommendations. Segregation of assets is one of the other recommendations from Italy, where you need physical separation of the facilities, but also assets in terms of all of your other resources, all of your equipment. You need to ensure that your equipment for the hospital without PPE is without COVID is not mixed with the hospital that treating COVID, because you don't want a situation where somebody who has COVID goes in or the air goes in and then you contaminate everything. So you have to separate the assets. It also includes separating staff, where you have people who are dedicated to treating with COVID-19 and staff dedicated to treating with the other patients. Because again, you don't want that commingling of staff, not even the staff. And of course, the staff that you need to treat with the COVID-19, you need to ensure that you have an infectious control specialist who knows what they're doing. And you see, that's the thing. We have people in Tobago, born and bred Tobagonians, who know about these things. Dr. Nathaniel Duke was one when he was here. I don't even know where he is now. We should have ensured that we found Dr. Nathaniel Duke wherever he was, wherever he is, and brought him back here. Because Dr. Nathaniel Duke is actually one of the only certified, trained infectious control physicians on the island. Yes, there may have been other issues with management skills and administrative skills and all of that. We are in a point now where we need all hands on deck, and we need the best of the best. And when it comes to infection control, he is and was one of the best. And he's a Tobagonian. It is what it is. Whether we like him or whether we like working with him or not, we need to have all hands on deck. The other thing that the Italian group realize now after the fact is that so the first one was ensuring that we protect our staff. The second one was division of assets, separation of assets. And the third one is modification of clinical practice. And that includes even modification of the clinical practice of non-COVID patients, because we need to change all of that. Right now, we don't need anybody who is not absolutely critical going to any of our health facilities. I would suggest shutting down almost all of our health centers, identifying 4 or 5 or 6 of them, concentrating the staff in those areas, and they then rotate so that we have 18 or at least 24-hour service in those health facilities, and have them manage our non-COVID patients. Because remember, we have COVID patients who are hospitalized, non-COVID patients who are hospitalized, and we have non-COVID patients who are outpatients. And they could be working with doing telehealth. So instead of having people come into their regular clinics, call them, tell them, you're not coming into your regular clinics. We are giving you your prescription for the next 3 to 6 months, depending on the situation, depending on who it is, depending on an assessment of that patient. Give them numbers so that they can call if they need some emergencies happening. So they know what to do. Have cancer clinics like dental clinics and those things. Because remember, those people also use PPEs, and because we have limited PPEs, we want to limit the interaction with people to have to force the healthcare professionals to use the PPEs. So call them on the phone, talk about the diagnosis on the phone, and then based on that, based on the assessment of the patient, then determine whether you need to bring them in, you go see them, or whatever is necessary. Concentrate our outpatients, concentrate our community care, concentrate our health centers into these 4 or 5 or 6 health centers, and have those health centers manage and do. Even the other thing, we have to ensure that whenever we have patients coming in, those patients need to be thermal tested at the gate. Because we have patients coming in with other signs and symptoms for other things, but they have COVID. And if we don't know, they don't know. They come in interacting with the doctor or nurse normal. And remember, because these are non-COVID health facilities, the PPE that the health professionals are using the non-COVID PPE, which is not the heavy mask down, heavy glove down, heavy goggles and all of that. So you need to be able to screen all of those people before they have any interaction with any doctor or nurse. Do the thermal testing at the door, at the gate, down the hill before they even come up, to make sure that they don't have a temperature. And if they have the temperature, we then know, okay, that person needs to go do a beehive. Have them either tested immediately if we could do the testing, or figure out what else they may have. Those are the kinds of reworking of the clinical setting that we need to do. We have to do it, or we are going to have a situation where we have absolutely no control over what is happening on the island, and before we recognize it, I start hearing that granny so and so gets sick and granny so and so died. And I really, honestly, Tobago, I can't deal with that. I would not be able to deal with that, because we have enough time, we have ample people, we have ample resources to do this right from now. Because remember, we still a couple weeks behind everybody, but the longer we take to implement these things, the harder it will be for us to catch up after the fact. We have to take all of these things into consideration. Tobago, and I think this is going to be the last thing I say before I end. We need a dedicated treatment facility in Tobago. This whole idea, I know it was the plan A, of sending patients from Tobago to Trinidad via Coast Guard. I know it was the original plan, it was the plan A. That can't be with plan A anymore. We have figured out by now that plan A ain't working. That is why we have the patient in Tobago still in the hospital. Plan A, it now work. So we have to figure out plan B, C, D, E, F, all of them. And it has to include treating people here in Tobago. And that is not, let me not say it's not that difficult, because it is technically difficult. But we are in a position where we have to brainstorm and we have to think quickly. We have to think on our feet. We should have a group of people whose only job right now is to be a strategic group of people who sit and brainstorm about what to do. That should be their only job right now. Brainstorm about where we get, okay, so ministry said they're sending up PPEs, we ain't get it yet. Where is the plan B? Where is the plan C? Because we can't wait for ministry to send them. Find out, okay, they say we can't do testing and whatever, what are the other options for testing? Who are the suppliers outside of Trinidad and Tobago? So that if we can't get it from Trinidad, we'll go out, we'll figure it out. What is the best health facility to set up as a isolation space, as a hospital to treat COVID-19? Is it Canaan Health Center? Is it the Moriah Health Center that we are now finishing and now about to commission? Can we revamp that really quickly to use that as our COVID-19 hospital? Who are the staff that we need to have? Do we have enough staff currently? Do we need to ensure that people can't take, listen, you can't take no holidays right now. You can't retire right now. We just can't do it right now. All of the health professionals that are not working, they've recently retired. They've recently been sent home. Send out a call. Let's call those people. Hey, we need you. And come back early so that we have enough time to train you for a couple of days, a week, or whatever, to make sure that when you come back, you're not rusty. We need to be doing all of this right now, in addition to what the Office of the CMOH is doing. And bless her heart, Dr. Hoyt and her team, they have been under-resourced even before now, and they have been doing magic on behalf of Tobago. So in addition to what they're doing, we need other people to strategically brainstorm, to figure out, call suppliers, figure out what we need to do, where we need to go, how many people we need working. We need to do this. And if we don't, well, I guess they say God is a Trinity. Because that's going to be the only thing that saves us if we don't do this correctly and do it now. We don't have time. We don't have time to waste on this right now. We need to act. So I need you to start doing your own thing. Let me tell you. That is why, I mean, honestly, at the beginning of this, I tried my best to be apolitical, and I kept pushing personal responsibility, because I knew what it took to treat with this if it gets out of control. So I kept pushing personal responsibility so that even if the system fails, we don't have people getting sick. And if we don't have people getting sick, then a failed system is will survive. Nobody's sick anyway. So even if the system failed, so what? So it goes back to that, people. I need each and every one of you to pay attention to these social distancing rules. Stay your behind home. I know that on the list of essential services, they included the THA as if it's the whole of the THA supposed to go to work, but that is not the case. One of the ministers this morning had to actually say to people, even if you are an essential service, your managers or supervisor or whoever it is needs to still do whatever it can to ensure that you do not have to come to work if you don't need to. Even if you are an essential service and you can work from home because all you are doing is answering phones or typing or whatever, do it from home, because that is a safer place to be right now. All of you, please, the linemen, let me just cut that out now. My friends know, don't even bother calling me because I'm not coming. If you have something for me, leave it down by the gap. I got pick it up down by the gap, and when I come up, I'm sanitizing it. They know that. They know that. Because this thing is too serious to play around. Each of us have a responsibility to do what is right. We can't not do what is right. And let me just say one quick thing. Yesterday I got a notice that the media was called up to the hospital and different places to do a tour of our isolation and quarantining spaces. And I almost flipped because I couldn't understand why we would want to parade people who we don't know their infection status. Why would we want to parade them through a facility that is supposed to be a sterile, sanitized facility? There is no reason to march 10 journalists through a facility when we possibly have a community spread. Even if that facility is not currently being used right now, it's empty, which again says something. If at this point in the epidemic, those facilities now going up and empty, we really have to question something. But that is a digression. But we are where we are right now. We are told we have limited resources, and that includes limited sanitizing resources. So why would you want to parade a whole heaping set of people through a facility where you're going to have to sanitize it after are we done? Why would you want to do that? Makes absolutely no sense, and it shows that we really don't understand what we're doing. We really, if you wanted to show off that we have the facility, I understand. We need to show off that we have the facility. Sure, have one person go take a video of everything and then send that to the members of the media so they have it. We do not need to patrol anybody through any of those places, particularly since we are telling people stay home, and you calling a bunch of people who need to be staying home too and working from home to come and review a facility that should have been used all the time, but because we are lackadaisical and because we are behind the curve in so many things, it's now being set up. It's this level of madness that I can't deal with. And that is why, to be honest, that is why I am again doing this live this morning, because we need somebody to tell us the truth about what is happening. And we need to be honest, and we need to be critical, and we need to be thoughtful, and we need to be mindful with all of our actions. We are not in a normal time. We need to behave like if we are in a crisis, and we are not behaving like that right now. And if we don't behave properly now, we would really have a situation where we are hearing that so and so died, the person was already buried, and we couldn't even see them because we are in such a horrible situation. People, please, let's all of us act like if we have some sense, because that right now is what is absolutely needed from every one of us. I am hoping that those at the top behave like if we have sense. But I am also asking that those of us who are just regular citizens make sure that we stay home, because that if them at the top and behave like if it have sense, us staying home is the only thing that will save us. It's the only thing that will save us. Okay, so that's it. I think I have covered all of the things that I needed to cover this morning. So let's do this. Let us do this. We could do it, you know. Tobago has some of the smartest people in the world. I don't care what nobody say. When we leave Tobago, we are the head in Trinidad, the head all over the world. We could do this. We have smart people who could think. We can do this. Individually, you please mind your business. Stay home. Ensure that you do not come into contact with anybody's boulders, and nobody comes into contact with your boulders. Oh, talking about boulders, one more quick thing I got done just now. We are talking now about using face masks publicly, and it is for exactly the same reasons that I outlined above, because we don't know who has the virus, and because even if you are not coughing or sneezing, you are able to shed the virus by your boulders, the spit, the mouth water that does come out when we talk. It is important that if you are going out, or if you are in a space where you could accidentally come into contact with other people closer than the 6 feet, what is being recommended internationally, US, WHO, everybody is now recommending that we use something to cover our mouth. Now, because we have shortages of PPEs, as in the surgical masks, the N95 mask, and so forth, it may not be practical to tell every man jack to go out and buy surgical masks, because you don't want every man jack going out and buying surgical masks, and then our doctors and nurses and other healthcare professionals don't have access to that. So we have to be very careful. It's a delicate balance that we need to figure out where that balance is. But anything that covers your mouth is a good idea if you're going out. If you're home by yourself, then obviously you don't need it. So you know what? Stay home. Stay home. If you have to go out and you have to interact and you have to be out there, and you may control your sneeze, but you can't control everybody else's sneeze, wear a mask. I'm seeing some people doing homemade ones. Wonderful. The only thing is that we have to be careful not to touch our faces more because we are using the mask. If you are using one that you made at home, that is a cloth, no, it is not. That is not single use. You can use it, come back home when you get home in the safety of your home, wash it, dry it, and use it again the next time. And it's important to note, though, that even though we are saying use the mask, we are not saying use the mask and go, or we are not saying because you are using the mask you should go outside now. No. What we are saying is that if you must go outside, then the safer thing is to use the mask. So don't use that as an excuse to go outside because you now have on mask. No, it does not work like that. All right. So I just wanted to raise that. I am happy that you all were able to view the live. You can share it so that others can look at it, have watch parties with it so that others can look at it. And hopefully if everyone does the responsible thing, then we can defeat this. If not, honestly, crapple smoke with I. I am hoping that we all are able to survive this one. And with all of us behaving like if we are adults with common sense, we would all be able to survive this. Folks, we can do it. We can do this. We can do this. Thank you all so much. Thank you all so much. If you have any additional questions, please message me privately. Put it in this. I would respond. If I need to do another live again soon, I will do another one soon, depending on if we see more information coming out and so forth. But again, thank you all so much, and we all need to do what we need to do. Thanks. Bye.